Okay, so today we are going to start a very important module, which is statistics, and we will be covering this module into 2-3 lectures. Okay, and you need to practice these questions. So today we are going to read two topics. One would be a screening test, and the other is actually the observational studies. Okay, so basically these screening tests are very important. So you don't need to go into very detail of screening tests, that how it occurs, but tests you have to know that what is meant by sensitivity, what is meant by specificity. Okay, so basically we have some kinds of screening tests, and the prerequisites for those screening tests to be that they should be simple, safe, and acceptable, because these kinds of screening tests you are doing on a large number of population. Okay, so these has to be a simple, safe, and acceptable test. Like, you know that we have an NHS cervical screening program. Okay, so this is an example of screening test. And you know that this NHS cervical screening program is basically, this test is actually the test we are doing, that is a pap smear test. Okay, so it is a very simple, and you can say that it is a very easy and acceptable for most women. Okay, so this is how the screening tests they are adopted. So first it has to be a simple, safe, and acceptable, and it should have a high sensitivity and specificity as well, because this purpose is actually to diagnose the earlier cases of any disease. So the test should be much sensitive. Okay, so high sensitivity, high specificity, we'll be discussing these two terms in our next slides. So the test should have these two things, being reproducible, and cutoff values should be there, and should be a cost effective method. Okay, so these are just prerequisites of any screening test. Now whenever you done a test, so the test has a two possibility, like it can be a positive or a negative result, and this test can be correct or incorrect. So that is how we have four possibilities of any screening or any test. Basically, we would be having a four possibility that either it diagnose the true, if it diagnose the true cases, it means that this is the true positive rate. Okay, so it means that the test which diagnose that individual as a positive is actually a true diseased person. So it means this is a true positive of that test. And then there's some things, the false positive, that the test shows positive result, but it is actually a false thing. It is it this individual does not have any kind of disease, so it is termed as a false positive. Now in negative we have two categories. One is true negative and false negative. True negative means that the test is also showing that it is a negative for that disease. And also if you just compare with any standard or gold standard test, that also show that okay, this patient has not any disease, it means that test is actually detect true negative. And if fourth possibility is actually the false negative. So false negative means that this test actually showed it to be negative, but it is actually false. That because the gold standard test has says that no, this is actually a diseased individual. So this is how the true positive, true negative, false positives, and false negative, so these four possibilities arises from any test. So the efficiency of any test can be determined by working out sensitivity and specificity, or the positive and negative predictive value. So efficiency is based on all these four tests we'll be discussing. Next slide. So this is how we actually categorize. You'll be having even in exam questions like this kind of, you can say a 2x2 table. Okay. So these things are very, very important. You need to know these things. So this first column is actually a diseased column. Like you can say that it is a diseased, or you can say that if any gold standard test, which is actually the standard test, says it is a positive individual. So this first column is actually the diseased individual columns. The second is actually non-diseased. So non-diseased means that the by diagnosing from a gold standard test, it is actually a negative individuals. Okay, and here on a in the horizontal plane, you have here it is actually the comparison. So this is, you can say that this is here you are writing the screening test which you are actually testing. So this is here the screening test is actually positive. So these are all the positive, true positive and false positive, and this is the true negative. If you see this diagram, what does it shows? That this is the true positive. True positive means that this test shows the positive, and it is also a diseased individual. So it means that this test has detected these true positive individuals. Okay, and if you see that this another category which is actually the false positive, it means that the test has diagnosed this as positive, but it is a non-diseased individual. So it means these patients are actually falsely detected by that screening test. So the screening test shows the false positive individuals. Okay, so the next category, so this is the first horizontal column. The second column shows the negative individuals, negative test. Okay, negative screen test, or you can say that we will be discussing in odds ratio type of charts. Here would be the diseased in the vertical column, and here would be your exposure. Okay, so the smokers, non-smokers, these kind of examples would be there. So here the test is negative and it detect this kind of individual, these box. Actually, it is the test shows the negative, but they are actually the diseased individual. So it means that it has the false negative. Okay, it should be positive, but the test shows the negative. So it means that is they are false negative. And these are actually the true negatives, that the test also shows that these are negative and they are actually the negative individuals who are non-diseased. So this is how this 2 into 2 table it actually make. And you must be seeing in some books like they have written A B C D kind of things as well. Okay, so just for your easy purpose, you can remember the formulas like this ABC. But true positive, false positive, this is actually an easy way if you just understand things. Okay, so first thing is sensitivity. So what is actually the sensitivity? So sensitivity is actually that the probability that it will produce a true positive result when used on an affected population. So sensitivity means that you truly detect the disease. Okay, so the test which has high sensitivity means that this test actually truly diagnose the disease. It means that true positives would be more. Okay, so it will produce a true positive result when used on an infected population. Now the formula is actually this true positive and divided by, you can remember it like this, that whole positives. Okay, so true positive divided by true positive plus false positive. Hmm, नहीं, आई थिंक ये गलत है. हाँ, ये नहीं है. दिस एक्चुअली ये जो फॉर्मूला लिखा है ना, होल पॉजिटिव नहीं आता, ये तो पॉजिटिव प्रोडक्टिव वैल्यू थी. सो बेसिकली इसका ना इजी वे इस तरह था. ये अगर आप चार्ट देखें ना, इफ यू सी दिस चार्ट, तो this first column is actually your sensitivity. It means that true positive divided by true positive plus false negative. So divided, जो denominator है ना, nominator तो आपका true positive है, but denominator is actually the total affected individuals. Because total affected में से you have to see that how many true positives you have diagnosed. Okay, so this table, this first vertical column is actually your sensitivity. Okay, so I think this misprinting हो गया. So it it actually has true positive divided by false negative, not false positive. Okay, so this is actually the sensitivity. And if you see the specificity, so specificity is just the opposite of sensitivity. Now here the test, actually it is the probability that the test produce a true negative result. So it means that negativity, the true negative test, true negative result would be more when used on an unaffected population. See, this unaffected population, it means a non-diseased individuals. So this specificity is actually the column of, if you see this diagram, this table, so this sensitivity, specificity is actually this column. So what is actually true negative? See, this is the true negative. So true negative divided by true negative plus false positive. Why we are writing false positive? Because both are actually the non-diseased individuals. So the specificity of a test actually detects the true negative. The more would be the true negative, it means that more would be the specificity of the test. And this first column, if you just remember like this is actually the sensitivity, this is specificity. So in sensitivity, you have more true positive. If a test has high sensitivity, it means it diagnoses more true positive from those which are actually the affected individuals. So this is actually you can say that the total population would be the diseased population. In specificity, we have non-diseased population. Okay, so these two terms are very important. So see this specificity, true negative divided by false positive plus true negative. Okay, so positive predictive value. So this is the positive predictive value. It is actually the positive, all positives you can say. So the person is affected. The probability is that the person is affected when a positive result is observed. Okay, so it means that, okay, whenever you have the screening test is actually the positive. Okay, so true. So how many chances that a person is affected? It means this test is actually determining from whole positives of the test. So this is actually the positives. You can say the true positive divided by all positives. So all positives are actually true positive plus false positive. Okay. So this is the positive predictive value, that the positive test predictive value. Okay, so this is actually the when the positive result is actually obtained, so you are at the test is positive and how many would be affected. So true positive would be more again here. Okay, so just the opposite of this is negative predictive value. So in the negative predictive value is that when the person is actually not affected and a negative test is observed. So this is just an opposite of positive. It means true negatives divided by true negative plus false negative, means all negatives. If you see again that table, okay, so now here would be the this positive predictive values. So see, this is the test positive. So here would be the positive predictive value, and this is the test negative, and here would be the negative predictive value. So this horizontal columns are these predictive values. See, true positive is divided by all positives. Okay, so true negative divided by all negative. Okay, so these formulas are very, very important to remember, and this usually come in exam. Okay, so let's have a quick just a quick you can say that question of these charts. Okay, so these are actually all the if you just read out this, that basically we are in this table, this is an example of these tests. So basically they are comparing a new test with a previous gold standard test. Okay, so here they are written a lab test, so lab test positive, lab test negative, and this is they have written the new test and their positive and negative value. So this is true positive, false positive, false negative and true negative. Okay, so this kind of table you would be getting in exam, or either they have written these kinds of things that, okay, 40, like this is the 40. So 40 40 people are screened positive with the new test. Okay, in the diseased, or you can say in diseased individuals, 40 screened positive. So you would be writing this, if you see this line, you would be writing this in the true positives. And this is how they give you exam. They give you like statements in exam, or either they also give this 2 into 2 table in exam. So this is the table you have received in exam, and they are asking you now the sensitivity of the test. So sensitivity, just easy way to remember this. So the arrangement would be same. Okay, so you cannot say that the arrangement is disturbed, and you also have to write, if you want to make a table, you also have to write the table like this. Okay, so true positive always here, false positive here, false negative, and true negative. Okay, so this arrangement would be uh, same. So the sensitivity, whenever they ask you, sensitivity means that this first vertical column, so what it has, that true positive divided by true positive plus false negative. Okay, so upper denominator is 40, and divide, if you add these two, it means 40 divided by 50. Okay, so 4 by 5 और जो भी आंसर आएगा 0.8 ही था. So the rough estimate, or you can because there's no calculator allowed in exams, so you can just do the mathematics, if you remember that how actually you do this. So you 0.58. Okay, so this is the 0.8. Okay. Okay, so if you see this, the sensitivity is a measure of how good the test is at detecting those with the disease. Okay, so true positives, actually, the sensitivity diagnose true positives. So the formula is same, and you detect this 0.8. Okay, so again, the same table, and you are going to diagnose the specificity. So specificity is this column. So here you would be writing true negative above and true negative plus false positive. Okay, you cannot write false positive above. Okay, so true negative above, and the whole would be the denominator. So true negatives are 20, and divided by, if you add both, then 20 divided by 50. So this is here 2 by 5, and 2 by 5, if you say that, okay, 5 4 20, so means 0.4 would be here. So this, an easy division method you also would be knowing. Okay, so here if you see that this is a specificity, and it actually correctly exclude those without the disease, means it actually diagnose those true negatives. So the formula is same, and you get this answer, which is actually 0.4. Okay, so how you calculate the negative predictive value and positive predictive value again. So you remember, this is actually the positive predictive value, this vertical horizontal column, and this column actually negative predictive value. So in negative predictive value, we have true negative, always the true thing is above. Okay, so this is also an easy way to remember, always would be true positive or true negative would be nominator. Okay, and denominator, you can have all the false things and true also. So true negative plus false negative. So true negative are 20, and divided by all negatives are 30. So 2 by 3. Okay, 2 by 3 recover. So 2 by 3 is the answer here. So this is the negative predictive value, and this is how you can also diagnose the positive predictive value. Okay. So negative predictive value, the likelihood of a person testing negative for a condition not actually having it, means that the test is actually the negative, and also the disease is not present, means again it actually means that true negative would be more. Okay, so these are actually the 4 very important definitions, and that you need to practice those questions. Okay, so we have 2 conditions now, the incidence and prevalence. So the incidence of a disease and the prevalence of disease. So basically the incidence, just easy way to remember, is that all the new cases of the disease, not the previous one or not, you can say the old, not the old ones, just the new cases. So the incidence is the rate at which new cases of the disease occur in the population previously free of it. Okay. So incidence is actually, this formula is that the R is actually the new cases and divided by total population into the time interval, that during this time, this to this time interval, how many new cases actually arises. So this is actually the incidence of any disease. And the prevalence means that actually it is the frequency of existing disease at a given time. Now, in this prevalence, you include all the cases which are actually, you can say, the diseased patients which are actually present. So it is not only new. So you can say that new plus old, all disease are present in the this prevalence. So in prevalence, this formula is actually again the all cases are now is the total number of cases, okay, and divided by the total population. So total number of cases of that disease. So this is the incidence and prevalence, a brief difference between these two. Okay, so now the observational studies. So basically we have, you can say that 5-6 observational studies, and then we have an experimental study. We have these two kinds of you are actually doing some alignment, and observation means you are just observing anything. You are that. This is how the observation studies and experimental studies are. A few times you can say. So first is actually a case report. A case report is just say case. You are just reporting any different any case which is actually present in one individual. Okay, so any objectively that you can say that whenever you see any unique kind of patient, so you can submit any case report of that. Okay, so the case report is actually of a single subject, n is equal to 1. So any man with treatment resistant TB, and there is no control group. You are not comparing that individual with any other individual. Okay, so this is about just a single individual. And then there are case series report. So the name actually indicates it's just actually a case report, but a series of that. Series means that more individuals are in that report. So basically, again, it is an objective report of clinical characteristic or outcome from a group of clinical subjects. Okay, so this is the difference here. Case report, case series report. So a group of subjects, you are seeing that disease in a multiple patients. Sure, so you are just combining up with all the data of those patients. So that is actually a case series report. So here more than one patients would be present. Okay, so now the cross-sectional study. So cross-sectional study are actually those, basically they are actually at a particular time. Here the time is actually important. Cross-sectional means at one particular time you are doing a study, only one particular time. You are not going beyond or you are not going backward. Okay, so at just one particular time you are comparing, like presence or absence of disease and other variables are determined in each member of study population or in a representative sample at a particular time. Okay, so disease prevalence you can record like this, because it's time, at particular time you are comparing or you are seeing that okay, this disease is much prevalent here. So we are actually studying a cross-sectional study. Okay, so again, the two very important studies. One is actually the case control study and the other one is cohort study. Okay, so these two are very important. Now, case control. So case control, actually, you can easily remember that it is almost always retrospective. Retrospective means that you are going backward. Now, how we are going backward, that you are actually identifying a group of people with the disease, like you have seen that, okay, this disease is uh, prevalent, and you are taking a group of people with that disease, be it a lung cancer or any kind of disease, and then you compare them with suitable comparison group, like you have the both groups have to be a similar characteristics according to the gender, the age group, for these kinds of things you have to just balance, but those should be without the disease. Okay, so this is how they are called a case control study. So case are those with the disease, so these are the case, and those without the disease, they are actually your control groups. And you have diagnosed, okay, so it means that you are knowing the individuals with the disease and without the disease, and then you are going backward, you are looking backward, that, or you can say that you are looking in the data of those individuals, that what is actually the problem between these two groups, why these case actually they have the disease, and why these control they do not have that disease. So it means that you are going backward, you are just reviewing their backward their data, and then you diagnose that, okay, these actually those which are cases, basically they are actually smokers as well. Okay, so that is how you can diagnose any risk factor in those individuals, or anything that they are obese, or any kind of a link you can diagnose. So this is actually the you can say the case control study. Okay, so this important is actually this, that is it is used in diagnostic test studies, and it help actually causal relationships, so the relationship between the any exposure with the disease. Okay, so if you just see this diagram, this is how, see the this cross section study is at a particular time, at one point you are studying, which is a cross sectional study. And if you go backward like this would be a case control study. And in case control study, we will be using some odds ratio as well. Okay, so the next would be cohort. So we'll be studying cohort here. So cohort, actually it can be two directions, but usually it is a prospective study, but it can also be a retrospective. Okay, but in cohort is actually, here the things are opposite, you can say. Here you diagnose one group which are exposed to a risk factor. Now, here you are not diagnosing, you are not grouping the patients into any kind of disease. You just see a group of people and you say that, okay, they are exposed to this risk factor. Like, just you take example of smoking. We know that smoking causes the lung cancer. Okay, so if we did not know that, and then you just take a smoking risk factor. So you take a group of people with the smoking, and then you follow those individuals over time, and then you compared. See, now the comparison here with not a diseased individual, disease and non-disease. Now the comparison here is actually one individual with the risk factor and the second group not exposed to the risk factor. So one group is actually, you can say, a smoker group, and the second group would be a non-smoker group. Okay, so here actually the risk factor exposure. So basically exposure or no exposure is actually comparing. Now you go over time, you follow those individuals. So that is how they are called the prospective study. So you take two groups of people, one are the smokers and the other are non-smokers, and then you go over time, you see after 2 years, 3 years, or 20 years, you can follow them. And then you see that, okay, how many individuals from this first group smoker they develop the disease, and how many individuals from non-smokers uh, they di- they diagnosed with that disease. Okay, so this is how you actually take these individuals in a prospective way to see that this risk factor actually it causes the disease or not. Okay, so it is actually, you can say, a time taking and a long study. Okay, so you can use for prognostic test studies, and allows you to evaluate whether potential risk factors are related to outcome or not. Means that if you see like a smoker, non-smoker, and if the result shows that after 10 years, both group have equal incidence of disease, like equal lung cancer disease is present in both groups. So you can say that, okay, smoking is actually not a risk factor. It means smoking is not causing anything, because because both the smokers and non-smokers, they are having a similar outcome. It means that this risk factor is not a risk factor actually. So you can evaluate the risk factors to the subsequent outcomes, and it's usually a prospective study. So forward in time you go, can determine incidence causal relationship, must follow population long enough for incidence to appear. So you have to go very long, then 20 years maybe you can want to see these individuals. Okay, so this is how we divide these two groups. So cohort study, case control study, these two are very important. Okay, so case control would always be, you can say, the retrospective, and here case control. So case are diseased and control are without disease. Okay, so this is the difference between these two. But in cohort, you are actually, there is no diseased individual. You just exposure group and a non-exposure group. Okay, so this is how they are divided. Okay, so odds ratio. So we are actually detecting the disease in the odds ratio. So this actually ratio is very important. So odds ratio is actually that the increased odds of getting a disease with exposure to a risk factor versus non-exposure to that factor. If you just see that again, this is 2 into 2 table. So this is the lung cancer patients, that the disease, or you can say the diseased patients, and this column is no lung cancer, means non-diseased patients. Okay, so here, like previously we discussed in sensitivity test, that here we will be writing the test is positive or test is negative, and here you would be in odds ratio, you'd be seeing that exposure is positive, means smokers, and exposure is negative, so non-smokers. Okay, so this is actually again a 2 into 2 table. So you would be seeing that, okay, the smoker, so if you see this patient 659, it means 659 individuals, they are smokers and they have lung cancers. Okay, and how many non-smokers get lung cancer? Only 25. See, if you just see the table, you would be seeing that, okay, so it means that smokers, this is a smoking is a risk factor, because smokers get more lung cancer than non-smokers. Okay, so if you see that the no lung cancer, again, even 984 individuals are actually smokers, but they do not get lung cancer. And but out of these, if you just see that this 348 non-smokers, they actually do not have lung cancer. So this is actually just a table of exposure with the controls. And just an easy way to remember the odds ratio, that how you calculate, is that you just multiply these two things, crisscross things, A into D divided by B into C. Okay, so this is how you actually diagnose this odds ratio. So what actually is the formula? Odds of exposure for cases. divided by odds of exposure for controls. Okay, so actually it means that basically the formula is odds of exposure for cases. So these are actually the cases. So this is a case and this is the control group. See, so that is why we discussed that in case control study we are using this odds ratio. So this is the first column is case, second column is control. So odds of exposure for cases means that odds of exposure A smoker divided by C. This is the odds of exposure for cases. So these are cases. So the first group would be this, and the second is, you can say that odds of exposure for controls. So the B divided by D. So this is actually the division, that A divided by C, B divided by D, and then you just know that this is how it goes upward, it goes downward. So A into D, B into C actually appears. So just an easy way to remember is that you just crisscross the table. So if you see just this diagram, you can calculate the odds ratio. So it tell you that just cross multiply. So what happens is that how you calculate odds ratio, AD divided by BC, AD 659, multiply this 348, 984 multiply this 25, and the value is actually 9.32. So what does it means? What does this 9 means? So 9 means that the odds of having been a smoker are more than 9 times greater for someone with lung cancer compared with someone without lung cancer. Like those individuals which are smoker, they have 9 times more chances to get the lung cancer. So this is how the exposure, the risk factor causal relationship with the disease actually you diagnose. So whenever the odds ratio is approaches 1, it means that increased risk of outcome with exposure. And if you have any value of odds ratio, like you get the odds ratio value of 0.9 or 0.8, you can say, like less than 1, you can say, then you can say that, okay, exposure is not risk factor for the disease. So whenever it would be 1 or approaching 1, then only the risk would be with the exposure. Okay, so this is how we detect this odds ratio. So okay, so these were all about the observational studies. Just a quick review of RCT. So this is an experimental study, that randomized controlled clinical trial. So this is in this randomized. What does it mean? That you randomly allocate. See, observational studies, you know that, okay, these are case, these are controls. This is a group with the risk factor. This is a group without the risk factor. But here you are just doing an experiment. So experiment would be like you have to randomly allocate the individuals into 2 groups. So one would be the intervention group, where you are experimenting your any regime, any disease, any drug, or you are just giving any kind of thing to the individual. So the intervention group, and the second is actually the control group. So to receive or not to receive an experimental, preventive, or therapeutic procedure or intervention, so anything you are actually detecting in this RCT, so you just randomly allocate the 2 patients, one into intervention group, one into control group. So in intervention group, you are giving something, control group, you are not giving anything, or you can give a placebo type of thing. Okay, so it is actually the most scientifically rigorous studies available in epidemiology and the double blind category. There's a category double blind. In double blind, there's actually least subject to bias. Bias means any kind of error which can happen in the study, but it would be expensive. So double blind means that neither the subject nor the researchers, they actually know that which treatment they are getting. Okay, so you are actually randomly allocating, but usually the researcher, if I am doing the research, I know that, okay, I am giving one regime to like I am giving this placebo regime to one individual and I am giving this experimental regime to the other individual. But in double blind, I do not know that, okay, to whom I am giving which drug, because they are actually double blinded things. So in placebo and or the drug you are testing basically. So in double blind, you do not know that, neither the subject nor the researcher is knowing that which individuals are getting which kind of drug. Okay, so you just need to copy the result. Okay, so this experiment makes this result, this experiment, so it would be analyzed later on. Okay, so this is how the double blind RCTs usually we having in our case studies. Okay, okay, so this was all about today's lecture. I am just I have give you two basic things. One was actually those screening test we discussed, and the second is actually this observational, or you can say the studies, all the case control cohort RCTs. Okay, so just revise these things again. I have only 3 questions. So, which of the following term would reflect the number of cases of thyroid cancer correctly identified by this new test? Okay, so here you are testing that, okay, this test, okay, so it means that you are, uh, this is any kind of screening, or you can say the diagnostic test, and you are checking the effective, you can say that the efficiency of that test. So, number of cases of thyroid cancer correctly identified. So, it means that the true positive you are diagnosing, okay, by this new test. So it means that we are checking the sensitivity of the test. Sensitivity means that you diagnose truly the diseased individuals with that new test. Okay, so the next is, which of the following is true? So the incident tells how common a situation is. No incidents cannot tell you that. So incidents only just detect you that, okay, these are the number of new cases of the disease in a current time, and the prevalence tells how often a situation occurs. No, it cannot. It just know that, okay, this much patients are diseased, so not a frequency of the patient. Now the sensitivity is the probability of the test being positive in somebody with the condition. Okay, so probability of the test being positive means the true positive in somebody with the condition, with the diseased. Okay, so if you just remember that first vertical column, the of diseased, so I told you that the true positives in the somebody with the condition, so true positive in whole diseased individuals is actually your sensitivity. Okay, so this is the true in STEM. The reliability of test is defined as relevance of the test to the activities being treated, no specificity. So specificity is actually positive test given the absence of the condition. No, if here the negative test is written, then this option is also correct. Okay, so the sensitivity option C is correct. Here, which of the following terms describe the portion of individuals with a positive screening test who actually have the disease? Okay, so proportion of individuals with a positive screening test. Again, your true positives. Okay, so this is the positive predictive value. Okay, so here the example of your study. So study the random selection of 12 adults agreed to participate in the study of effect of drug. So they are followed prospectively for a period of 5 years to see if there's an association between the incidence of cataract and the use of drug. So if you see this word prospective study and you see that, okay, they are giving some kind of drug, means one kind of individuals they are actually giving some kind of exposure and to a non-exposure, so it means this would be your prospective study, would be your cohort study. Okay, so which of the following term describes a study comparing the characteristics of subjects selected on the basis of their disease status? So here you are categorizing those individuals into two groups on your disease status. So you know that diseased individuals one group and non-diseased individual is another group. So this is actually your case, and this non-diseased are actually your control. So this kind of you can say the study is actually your case control study. Okay, so this is all about today's lecture. So again, the case control study compares individuals have a particular disease with those who do not have the disease. Okay, so case control can help determine if an exposure is associated with an outcome. Okay, so this is all about today's lecture of statistics. If you have any question, you can ask me, and you have to practice your questions of statistics, because these are actually important. These formulas are very important. You need to practice them and remember them. Okay, so any question up till now, or should we end today's lecture? No question? Okay then.